This is your tailbone, and a lot of people experience pain here on your tailbone. There's typically three main reasons why people would have tailbone pain. It can be coming from where the tailbone intersects with the pelvic bone. This is called the sacroiliac joint, or the SI joint. It's right here. It could also be because there's something going on with the coccyx, which is this teeny little bony appendage where it connects to the sacrum. And sometimes if you've fallen on your butt or you've had some sort of injury to your coccyx, it can be really painful to sit here on your tailbone. And last but not least is tension that comes actually from the low back. Your low back is connected to your tailbone. So there can be issues with the lower back spine or some of the muscles around there that can contribute to tailbone pain. Regardless of the reason, it can be pain in the center of your tailbone, can be pain on the sides, and it's something that can be very uncomfortable. It can be uncomfortable to sit, it can be uncomfortable to sit on hard surfaces. It can even be uncomfortable to do activities like running or standing because of tailbone pain. One of the most common reasons for this is some sort of injury or trauma where you've gotten maybe fallen on your butt or twisted with one leg, maybe you slipped on ice or something like that. Also with a lot of instability. So if you're a woman and you have had a pregnancy where there's been a lot of ligament loosening with the relaxin hormones that are released during pregnancy and with childbirth, that can cause lots of movement in this area of the body, which can then create irritation in those areas that we just mentioned. Same with childbirth too. That can irritate the coccyx and irritate the tailbone. So all of these things, it sounds kind of complicated. There's lots of different pieces of the puzzle, but oftentimes one of the main things that can be addressed in tailbone pain is releasing the tension in the front of the hip and the back of the hip. Now, tension here in this muscle called the iliacus muscle, if there's tension here, you can imagine that tugging, like a pulley, right? Tugging here on this bone. And remember, where does that bone attach? The tailbone. So if there's tugging, pulling forward on that bone, it's going to irritate the back here. And that can be a hidden cause of tailbone pain. So by using a tool like the hip hook, where you lie on your stomach and put pressure on that muscle by rotating the tool and getting that to press on the iliacus, can cause that to relax a bit, which can then in turn not pull on the tailbone. In addition, when there's tension here in the front of the hip, that can play tug of war with the muscles in the back of the hip. These ones are pulling forward, these ones say no, and they're pulling backward. A lot of these muscles, there's some that actually aren't shown on this model, but this one is your piriformis. These are some of your deep hip rotators. There's a bunch that go right here, right along the sit bone. Those muscles, when they're tight, you can imagine them also pulling on this bone, right? And that again attaches to the tailbone. There are also a ton of teeny tiny ligaments in here that help support the tailbone. And if this bone is pulling, it's also pulling on those ligaments, which again is pulling on your tailbone. So releasing tension in the front of the hip and then using a ball like the hip flexor release ball to release tension in the back of the hip can be really useful at addressing tailbone pain. Now, if you have done that on both sides and you've worked with the iliacus and the psoas using the hip hook, and you have then worked on the back of your hip with the ball, and you notice absolutely no improvement, that's when you need some more precise technology, like the help of a chiropractor or a physical therapist that can look at the exact mechanics of your tailbone and figure out if there's a fracture, figure out if there's something else going on. But for the majority of people, the hidden cause is tension in these two muscles. And so by addressing that, you could heal yourself.